And finally, Peter Kemper from Pennsylvania State University. He's going to talk about Medicaid home care.
Well, thank you for inviting me to be part of this conference. I found it very stimulating. Being last on the program is not necessarily the most envious position. For one thing, everybody's ready to get on the road. For another reason, being fourth on a panel of research ideas where nobody's constrained before you, some of your points will have already been made. And finally, I have a limitation in my ability to remember and tell jokes. Before Josh's presentation, I thought of this as kind of a weakness, but after today, I think it might be a blessing. But yeah, I'm overcoming my disability. I have a confession to make, and that is all of my research has been done on the elderly population, and there are two reasons for that. One is there's more data on the elderly, primarily because the prevalence of disability is greater among the elderly population, so there are more data sets that have samples sufficient to do analysis. And the other is there have been more funding opportunities for me in working on the elderly, and we are, all of us who are in the business of providing evidence are usually funded by external grants and funding. I think the easiest way to solve the data problem, and the one place I would invest in more data, would be repeating the disability supplement to the National Health Interview Survey. With respect to the funding, I think the best solution would be for NIDR to give Penn State a rather large grant, and we would take care of that. Yeah, okay. All right. I want to talk about three research areas that I'm interested in and provide a little evidence, and then talk about additional evidence that's needed in those areas. And I am motivated in my research by wanting to provide evidence that is useful for policy or for practice and service delivery. So that will be common among these. Just as a preview, I have basically want to make three points. One is we need evidence on the effects of public programs in order to persuade policymakers. Josh made that point about the importance for policymakers to know, well, what are they getting from their spending? The second is that states need information that will allow them to track and improve their consumer-directed care and home and community-based service programs. And the third is that another theme that has come up before is we need more evidence on how to improve the jobs and the skills of the personal care workers and ultimately quality of care. So let me turn to the evidence on the effects of spending. I and my colleagues at Penn State have started to investigate the relationship between spending and unmet need. Earlier, Mitch presented a lot of evidence that makes the case that unmet need is prevalent and that it's a problem. And so we're focused on, does spending actually on home and community-based services actually reduce unmet need? So we Martin earlier showed how much variation there is in home and community-based services spending across states. These are spending on aged and aged disabled and other community-based services per poor elderly person. And you see the wide variance in the distribution of spending across states. What we did was to divide states into 4 quartiles based on how much spending they had and look at the variation across time and across states to estimate the relationship between spending and unmet need. And this is what Mitch earlier referred to as a comparative measure of unmet need. Are people who have a need for long-term personal care assistance receiving services. And what we found, what this slide shows, is that in the green is the bottom spending quartile, and in the pink is the top spending quartile in terms of states. And we broke the sample down into poor, less than 150% of the SSI income eligibility level, 150 to 300%, and over 300%. And as you see, as you would expect in the higher income group, there's no difference in unmet need across in those between the top and the bottom spending states. But in the low income population, where you would expect the effect, we did see a pretty substantial reduction in the percent of the population with ADL limitations who had unmet need. So I think in that's started providing evidence. We need more compelling measures of unmet need, and those tend not to be available beyond the disability supplement in national surveys that are available across state. More information on consequences of unmet need, quality of life benefits, benefits to families, to get a set of outcomes on the effect of spending.